for much longer. I'll start off my talk on the FRCS examinations, nuts and bolts, and we can see how it goes from there. Okay, so there are three royal colleges essentially in the UK, which are responsible for training and continued education of medical graduates. The Royal College of Surgeons of Edinburgh, 1505 was the year of establishment. The Royal College of Physicians and Surgeons of Glasgow, which was established in 1599, and the Royal College of Ophthalmologists based in London, which was established most recently in 1988. So as you can see from their crests and seals that they have a very hoary past, and they're almost remind us of Hogwarts and other Harry Potter settings. And I'll be limiting my talk to the college in Glasgow, which is the Royal College of Physicians and Surgeons of Glasgow. And as I mentioned, it's a lovely city with a medieval past, and also incidentally the heart attack capital of Europe, because they have the highest incidence of myocardial infarction. That's a fried Mars bar, a deep fried Mars bar. They have a tradition, a culinary tradition of deep frying anything and everything. So that probably accounts for their high rate of cardiovascular morbidity and mortality. But you can see some glimpses of the convocation ceremony. I'm starting right at the very end and then proceeding as to how do you reach this point. My study buddy, Dr. Asif Virani, and I attended the convocation ceremony with our families. And it was a real lovely culmination of an effort which goes on for about 3 or 4 years. And here are a few glimpses of the convocation ceremony with everybody dressed in very colorful robes with a lot of pageantry and a lot of pomp. You can see that over there. So where does the journey start? So essentially the examination is divided into parts. There's a lot of confusion about nomenclature. So let's restrict ourselves to the parts 1, 2, and 3. And the part 1 is essentially a basic sciences and optics MCQ test. So I think this is common with, for example, the ICO examination. And there is a cross exemption. That means if you have done the ICO examination part 1, you need not appear for the part 1 of the FRCS Glasgow examination. Part 2 is further divided into 2. It's essentially on clinical sciences, but there is an MCQ test as well as a written paper. The MCQ test exemption is possible if you have done the ICO part 2, but you have no exemption from writing the written paper. The written paper consists of 4 questions. 3 of them are on ophthalmology and 1 of them is on general medicine. That's medical emergencies essentially, and that is an important part of the overall philosophy of the examination. You need to finish this, you need to successfully answer this question before you can complete the second part. So if you answer the other 3 well and you've passed in those 3, but if you fail in the medical general medicine question, you will not clear this part. The third part is actually the most probably interesting and the most exhilarating part, which is the structured oral examination and the clinical examination. These are the viva, in other words, and the clinical examination. So there are various sub-tables in them, and you need to prepare accordingly, of course. Who's eligible to appear for this examination? Essentially for part 1, you just need to have finished your internship plus 1 year of post-qualification MBBS training, post-MBBS training. For part 2, however, you need to have completed 5 years post-qualification training, of which 4.5 years should be in ophthalmology. So there's actually an exemption. If you've done 6 months in an allied field, for example, anything like radiology or ENT, or you took up a residency which you dropped halfway and then joined ophthalmology, you are still eligible to show that as part of your training. Part 3 essentially needs you to have completed parts 1 and 2 successfully. So there's no real time limit except for the part 2. These are the fees that are put up as of yesterday on the website. Every year you will notice that the amounts keep going up and up. So part 1 is £350, part 2 is £795, and part 3 has these fees are of the last year, because there is currently no clarity on whether part 3 is being conducted or not in the COVID setting. So part 3, the £1410 that you see over there is actually the fees from last year. So it is something that really can give you a bit of a headache if you don't not only do your academic planning, but also financial planning. The website very happily tells you that you have a maximum of 6 attempts for each part, but I think we'll all be quite old and infirm if we take 6 attempts to complete each part, as well as, needless to say, bankrupt. So you would like to finish the examination in as minimum number of attempts as possible. All of this and more details are given at the website rcpsg.ac.uk. Of course, you can just Google Royal College of Physicians and Surgeons of Glasgow and you will get to this website, which has all the latest information on exam applications, guidelines, suggested reading, deadlines, the fee structure, and everything else that you could ask for. Dr. Akshay has already touched upon the reciprocity between the Edinburgh College and the International Council of Ophthalmologists. So they have been in partnership since September 2018. And I won't be dwelling too much upon that. However, there is now a further clarity on new examinations that allow you to qualify for the FRCS. And we'll probably go into that a little later. So this is the flow chart that has already been discussed. And the website for the Royal College of Surgeons of Edinburgh is up there on your screen now. In general, all of these examinations use something called the modified Hangover technique. So this means that these examinations don't have a clear-cut pass mark, preset pass mark, for example, 50% or 35% as it is in Indian examinations. Here, the pass mark fluctuates depending upon the difficulty level of the exam. The more difficult an exam is or deemed to be is, the lower the pass mark is set. So an easy exam will have a higher pass mark and a more difficult exam will have a lower pass mark. So it's very nicely done so that it's objective and it helps you to really assess yourself amongst your peers, even in the presence of a very difficult exam. So how does one prepare for the examination? Akshay also spoke about this. So clinical optics essential reading would include the textbook by Elkington as well as the textbook by Dr. Khurana. Both of them are wonderful in their own right and have their own advantages. So I would suggest reading both of these. The part 1 basic sciences is almost essential to read these 2 books. The MCQs in basic sciences ophthalmology part is edited by John Ferris and has wonderful MCQs with answers and the reasons why a particular answer is correct. And if one wants to go into a little more detail, the textbook by John Forrester is also a wonderful read. Incidentally, John Forrester was awarded the honorary FRCS at the same convocation that I had attended. So it was quite an honor. For the part 2, essentially the MS and DNB syllabus is more than adequate. Whichever textbook you wish to read is great. But to assess how well you are doing or how well you may do, the Massachusetts Eye and Ear Infirmary Review Manual for Ophthalmology, edited by Jeffrey Lampkin, and there are Indian authors in there as well, have a wonderful series of very difficult MCQs, which could give you some insight as to how you would do in the exam. For the emergency medicine question, as I mentioned earlier, the Oxford Handbook of Clinical Medicine is an excellent book, and it has a section on medical emergencies, which every candidate should be well versed in, including the flow charts and dosages of different medication. So a few tips. In general, the FRCS examination is a very practical oriented examination. Theory is not tested even in the theory exam. For example, in Indian exams, we're often asked lists of various conditions or the most common causes in descending frequency, etc. Nothing of this nature is asked in this examination. It's very practical, and most of the questions test your approach to a particular clinical scenario. So one needs to have a very methodical approach and plan one's answer prior to setting it down on paper. So the schema that is followed is generally a progression from life-threatening conditions to vision-threatening conditions to something that's purely cosmetic. In the viva, in the part 3, as I mentioned earlier, there's a viva and there's a clinical examination. And the viva itself is called a structured oral examination, but it's really a whirlwind, and you have these various tables or subsections where you're going to be tested on different systems of the eye. And one needs to again pass individually. And you have two examiners at each station asking you in rotation questions that are in the form of a clinical situation or picture. It's interesting that these are specific questions and they have model answers. So if you hit the key words on the model answer, there's no reason why you cannot pass. But at the same time, if you try to bluff or bluster your way through, guess, then you probably may go off totally on the wrong track. Some of the examiners, or in some of the examinations, the examiners are instructed to bring you back to the point in the form of a hint, and you should build upon those hints so that you can at least get to a particular level of competence in that answer. Generally, there are subparts to the question which follow an easy to difficult rule, and the subsequent subparts build on the previous answers. So for example, if the first question is, what is your diagnosis? And if you fail to answer the particular diagnosis, the subsequent subparts become even more difficult to answer correctly, at which point the examiner may give you a hint. The clinical examination is where you actually examine patients, and there are a variety of patients kept for your examination. And these are the four tables or four subsections. Many times in Indian examinations, we leave certain subjects for option, as we call it, whether it is squint or oculoplasty. And unfortunately, in this examination, there is no such thing. You have to be well versed in all of these diseases and their examination techniques, because you have to individually pass in all of these substations. In general, the more patients you see, the better, because if you are doing well, the examiner will quickly switch you over to a new patient and give you an opportunity to do even better. Practice pays, and there are various ways in which you can practice both on live patients in your OPD as well as with a friend, and you can discuss how you would examine a particular case or how you would examine a particular disease. Even if it's verbal and even if it's totally in your imagination, I would strongly suggest one does at least that, because one may not see the classic examination cases in one's OPD for months together. So at least an imaginary sort of discussion is also helpful. So what are the advantages of the FRCS? So basically the FRCS exempts you from the PLAB when you, if you wish to emigrate to the UK and hunt for a job there. It does offer better remuneration in the Middle East. There are different salary structures and salary slabs if you have an FRCS degree versus if you don't. It may not be any longer accepted as a valid degree in ophthalmology. In Singapore and Hong Kong, I would strongly suggest one looks at the current rules when one is trying to emigrate to such places. As I mentioned earlier, there is a cross exemption with ICO. Both parts 1 and 2A can be cross exempted. A lot of people just enjoy giving examinations, and I was one of them. It sort of gives you a bit of an idea as to where you stand on an international scene. And many of us just like to have more and more letters after our name. We probably don't need to go to this extent, but having something additional that separates us from our peers is also something, I think, a major motivation for giving this examination. However, the examination does have strong disadvantages. It does not, in a sense, allow you to practice anywhere in as much as it is not a licensing examination, and it is very expensive. So as I mentioned earlier, financial planning is also required, not just an academic planning, because if you start the process and if you spend money, thousands of rupees on parts 1 and 2, and then you find that you're not motivated enough to appear for part 3, there are no special prizes for completing parts 1 and 2 if you don't complete the third part. So at Lakshmi Institute, in conjunction with Beyond Eye Care, we run an FRCS course, a training course for students and prospective candidates. These are a few scenes from some of the previous courses that we've had. We've done it successfully for 4 years, and last year we had to suspend it because of COVID, because the USP of our course is hands-on training with live patients, and that's very difficult in the pandemic situation. We're trying to see how we can resurrect this in the current situation, but anybody who's interested could take down this number over here and or the email address and contact us in the following month so that we could sort of organize something maybe on an online platform that would be useful to prospective candidates. Thank you so much for your patient hearing, and wish all prospective candidates and anybody who's interested in these type of examinations all the very best.